Share. Okay. Can you all see that okay? Perfect. Make that a little bit bigger. So yeah, today we're talking about healthcare. We're talking about clinics, cooperative clinics in particular is our area of expertise. So I'll share a little bit about how maybe a community can work towards improving access to healthcare themselves by creating a cooperative. But first, just a little bit about us. I don't know if folks are familiar with Co-operatives First. We're a nonprofit organization that's located in Saskatoon, but we work all across the 4 Western Canadian provinces. We do lots of work in Alberta, and we primarily focus on rural and Indigenous communities. Our organization is fully funded by Federated Cooperatives Limited and the Cooperative Retailing System, and their funding allows us to provide education and hands-on support and guidance for new cooperatives at no cost. All the services we provide are free. And in our work, we've helped create over 120 new cooperative businesses. I will admit, only a few of them have been healthcare related, but there's still some cool stories out there. And we do a lot of work with organizations like Community Futures, economic development practitioners, to get good information about cooperatives out there into the public, so that entrepreneurs, community groups, and people can just learn more about cooperatives and use cooperatives as a tool to address gaps or issues or challenges in their community. Right now, for example, we're seeing a lot of interest in housing and childcare cooperatives because of some of the funding that's available through the federal government. But of course, healthcare is one of those challenges in Canada that never really goes away. And that's particularly acute in rural areas. So on that note, let's pivot a little bit and get some context maybe. And I'll maybe ask folks, and there's only a few of us here, but I think I probably know the answer to the polls that I have. Could we just do like a quick maybe show of hands or like a thumbs up if your camera's off? If healthcare is one of your community's top 3 issues. Yeah. Yep, for sure. What if you've had to travel to access some kind of healthcare? That one's almost always the case, I would say, unless you're in one of the major cities. And how about if you're unable to access the healthcare that you need? Yeah, that one's a mixed bag. Certainly, if you need specialized care, mental health services, certain seniors services, that's a real challenge, especially in rural communities if you've got to travel to, say, the big city. Okay. And again, this is probably no surprise to you, but I thought I would just provide a little bit of context to talk about why healthcare is an issue and why maybe we should be doing something about it. Only about half of all Canadians are satisfied with healthcare. And that includes the whole gamut, from primary care with your family doctor to accessing specialized services to the wait times that we have in Canada. And from the Canadian Institute for Health Information, over 5 million people don't have family doctors. And all studies show that having a family doctor is critical for one's long-term health, for catching diseases early, for getting ahead of any medical concerns. But over 5 million people don't have family doctors. And as a result of that, we see a really high reliance on emergency care. People go into the emergency room for sprains and bruises and aches and pains that really should be directed towards a family physician. But because we have such a shortage, again, especially in rural communities, we see emergency rooms getting a bit overwhelmed. And in Alberta, the healthcare conversation, I probably don't need to tell you this, is a little wacky at the moment. There's lots of change happening in provincial healthcare. The AHS is getting revamped. The provincial government is making big changes to change how healthcare is delivered in the province. And while that's happening, and maybe that will improve services, while that's happening, wait times are growing. And most concerningly, and what's been making the news a lot lately, is that access to surgery is becoming increasingly concerning for people. And people are waiting a long, long, long time for life-saving surgeries. And again, not unique to Alberta, but a big challenge is that travel from rural is almost an essential to access some kind of care, whether that's something like dialysis, podiatry services, mental health care, seniors care, long-term living. Usually it's getting harder and harder for people to age in place or even just live in their community, their hometown, and access the level of care that they need. There's almost always some sort of travel. And in a country like Canada, that's expensive. It's expensive, it's difficult, and it can be a real challenge then for rural communities to grow and attract people. And so these are some of the headlines, that you see when you look up healthcare in Alberta, healthcare in Canada, real big challenges. In particular, that middle story, a family doctor is retiring. Now all those patients are going to lose their primary care physician. So what's that mean? How do we prevent things like that? How do we get ahead of those issues? What can we do? So I'll ask again, quick show of hands. If people in your town, in Lac-La-Biche or neighboring communities, want to see your town grow and thrive. Yeah. Who doesn't, right? No one keeps their hand down for that one. What if, are there untapped financial resources in your community? Are there maybe wealthy people? Are there businesses that want to maybe see the community grow? Are there untapped financial resources? Show of hands? Maybe hard to say. Hard to say. And I totally appreciate that's a hard one to judge. The data says yes. The data says yes. And another show of hands, would you be willing to dedicate some time, maybe a little bit of money, towards expanding local health services? Show of hands. Yeah. 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 A little bit of time, right? Okay. That's all good. Well, that reminds me of a great quote that we have from a friend of mine, the former mayor of Westlock, which is just down the road from y'all. Mayor Ralph said, if you want to make your community a better place, then you get up off your backside and you make it happen. And really, isn't that what a cooperative is? And he's right. When we, ordinary people, see an issue in our community, we see a gap in the services available to us, or maybe we see an opportunity where we can accomplish something by working together, that's what cooperatives really are. And that's the history of cooperatives in Canada, is ordinary people working together to get the goods and services that they need to live in their communities. So what's a cooperative clinic, you might be asking? Well, let's break it down a little bit. Starting with what's a cooperative? I assume in Western Canada, it's always pretty safe to assume someone's a part of at least one cooperative. Are folks part of co-ops in the meeting? Do you get your gas or groceries or hardware from a cooperative or bank with a credit union? Yeah, okay. Almost always. It's a pretty safe bet here in Western Canada. So some of the business structure, but really at its core, a cooperative is a way for people with a common need to get organized. It's just a way of doing business. And when you sign up to be a member or an owner of a cooperative, whether that's an individual or a business, you're all equal. If you've ever attended your co-op or your credit union's annual meeting, each of you get one equal vote. You can't buy a greater share of a cooperative business the way you can with other businesses. And that's because the purpose of the cooperative is to provide goods and services to its owners. And so the people who own the business use its services. So you can probably infer the patients or the owners of a cooperative clinic, of cooperative healthcare services, are the ones that are going to use the services and benefit from that cooperative. And a cooperative also provides a legal structure. It is just a way of doing business. It's a way of incorporating a business. So it offers more opportunities for fundraising and offers legal protection for the people who are starting the business. If you want to raise money from investors from members through membership fees. If you want to take on a loan or apply for grants, a cooperative provides a pretty safe way for individuals to come together and do that. And because cooperatives can be either for-profit or not-for-profit, it gives you a good bit of flexibility to identify the different fundraising avenues that matches the goal of your business. So what's a cooperative clinic? The idea behind a cooperative clinic really comes up in the 1960s. And I don't know if folks were alive back then, I certainly wasn't, and neither was my parents. But a cooperative clinic really starts popping up when we start to have nationalized healthcare. It was a way for communities to ensure that they had access to, at the time, affordable healthcare. Because it wasn't necessarily state provided, most people were paying some sort of funds for healthcare. And a cooperative clinic really challenged that and offered a more community-owned and collective approach to accessing healthcare. So the idea is that patients and the broader community invest in their own health services. And I'll give a few examples of what that looks like in a second. But what we see cooperative clinics look like now is usually they're used as tools to attract service providers. A cooperative, so for example, I assume none of us in the room are doctors, but all of us could still be members and owners of a cooperative clinic. We could create the cooperative and use it as a way to attract doctors, massage therapists, other healthcare service providers to a clinic. And that's because it's a vehicle to raise funds for local healthcare. John mentioned off the top that there are funds through Community Futures. There's also usually funds from the federal and provincial governments. Local governments are also usually willing to invest in these sorts of organizations. And so the cooperative can be the mechanism that can help access some of those funds. And the real gem for a cooperative clinic is it usually offers an alternative to professional-run clinics. The business model for most doctors' offices or most service providers is that those individuals have to be a service provider, be it a physician, a massage therapist, a mental health practitioner, a counselor, what have you, but they also need to be a business owner and a business manager and run a whole business. And many of them don't want to do that. And many of them can't make a go of that in a smaller town. And so having some components of that administration and that building management and that capital management housed under something like a cooperative clinic is really attractive then to service providers who might want to operate part-time in a community or might not want to deal with the administration of running a business and all the billing components that come with that. So most cooperative clinics in Canada, of which there's about 100, I would say. Many of them are in Saskatchewan. There's a few in British Columbia, and then we see a lot more in Ontario and Quebec. Most of them provide space. So the business model that the cooperative uses is almost like a landlord. The clinic is a community-owned space that offers healthcare services. And there's a bunch of different ways to organize. The two case studies that I'll use will really highlight that. And it offers that alternative to professional-run clinics. You know, most doctors don't go to medical school because they want to be business owners. They want to go to medical school so they can be doctors and help people. And so working in a cooperative clinic allows people to hand off a lot of that administrative burden to a community-run organization. And most cooperative clinics also allow, again, ordinary people a way of organizing to advocate for their own healthcare access. Once you have a space and some infrastructure to support more healthcare services in your town, you can then more rigorously approach service providers, provincial governments, different organizations to increase access and make a case for your town and say, we have space, come. There's a big market that you can access in Lac-La-Biche, and you can really advocate for your own healthcare access, and also seek out funds to support those endeavors. So how's that work? Generally, the way most of these organizations get started is they'll start by creating some sort of structure, be it a not-for-profit, for-profit business, or a cooperative. They'll identify a site where a clinic could operate, and then they'll either build and lease or renovate a space to design it for healthcare needs. This is a pretty regulated environment, and so identifying the kinds of healthcare that would be housed in a cooperative clinic is really essential to ensuring that the site that's built matches the regulations that you'll need to comply with. For example, if a cooperative clinic houses primary care physicians, like family doctors, there are certain requirements that you'll need to meet to match that. Whereas if you're providing a building that houses massage therapists and social workers who provide mental health services, or a podiatry clinic, then the needs of a space like that are very different and much more flexible. From there, a cooperative is a really good tool for raising the funds. So identifying what sources of capital would support the work you're doing is really essential. And cooperatives can operate as not-for-profit organizations, and so they can access grants, they can access loans, and they can raise money from selling bonds, or they can operate as a for-profit business. If you wanted to be a for-profit healthcare center, which again is just making money off of renting out space, maybe you can raise money from investors. Most small towns that I've been to have a lot of untapped financial resources. That's because most people have a retirement savings plan, or they have a tax-free savings account. And if you register a cooperative with an applicable program, you can transfer some of the monies that you've got tied up in your savings accounts into the cooperative. So why not invest some of your retirement savings where you can see the results? And a cooperative, a common good capital program is the one that we use to help people register their cooperatives to access those retirement savings. So why not invest in your hometown? From there, the cooperative can either hire or contract service providers, or they could simply enter leasing agreements with different service providers and have conversations and make deals with healthcare providers to set up shop in their cooperative clinic. And the revenue model for most of these organizations really depends on how they get organized. And I'll give two very different examples. But usually they charge rent to healthcare providers. They raise money from their membership. Many of them offer classes or provide space for different community activities. They can charge fees for folks who are members of the organization. And many of them also host fundraisers to raise lots of money. And then if you're a more integrated clinic, like the first example I'll share, the cooperative may handle the billing with the provincial government and charge for healthcare services. So let's get into a couple of examples to kind of contextualize what this could look like. I'll maybe say off the hop. I'm going to use two examples of a cooperative clinics, one much bigger than the other, and one much more, how should I put it, achievable than the other. One of these is very hard to start today. But you could certainly start a cooperative for any kind of health services. We've worked with cooperatives of midwives, where they wanted to open a midwifery clinic. So 5 midwives worked together to create a cooperative to operate their clinic. We've worked with cooperatives of massage therapists, who again, I think it's 8 massage therapists in that case, came together to set up their own clinic as a cooperative. Any sort of healthcare business like that could certainly work. The 2 clinics I'll talk about today are a little bit more community owned in nature, but certainly if folks have a specific business and want to be healthcare providers, that could certainly work as a cooperative, and there's lots of cool examples of those. But the first example I'll give was one of the first healthcare clinics or cooperative healthcare centers in Saskatchewan and in all of Canada. And it's the Prince Albert Cooperative Health Center Community Clinic. And related to this one is also the Mobile Crisis Cooperative. Share a video about them as well that tells their story. But how they work. Both of these organizations are what's called a community service charitable cooperative. So both of them are registered as not-for-profit organizations, which meant they can't raise that much money from investment. They raise a lot of money from fundraising, and they raise money from applying for grants. The people who own this business is anyone who wants a membership. Anyone in Prince Albert or region can sign up to be a member and help run this community-owned organization. For most folks, they do so on a volunteer basis. They give a little bit of their time because they value having a community-owned clinic and the services that come with it. They also value being able to show up at a co-op meeting and advocating for the different types of health services they need. And over the years, the Prince Albert Clinic has expanded from being just a primary care facility that had family doctors, and you could come see your family doctor at the clinic, to then they've expanded to offer things like podiatry services. They have some nurse practitioners who can do select services and things like blood work. And they've provided more things like substance abuse treatment for people who are in recovery. So again, the community, by virtue of owning the organization, can help shape the type of healthcare that gets offered. And this organization is a highly integrated model. So the co-op's administration, of which they have executive directors and admin staff, they support the healthcare providers, the doctors that do the work, and the cooperative itself bills the government of Saskatchewan, the provincial health authority, for services rendered. So most of the revenue is coming through the provision of healthcare services. Rather than charging rent to doctors, they're handling all the billing. So in these cases, the doctors are contracted by or employed by the cooperative. So these are pretty rare to start, I would say, but it is a good model for cooperatives that need that more integrated, robust healthcare approach. And let's give I have a video of these two cooperatives. Let's see if it plays from the embedded video. It is not. Okay, that's fine. I have a backup. Here we go. So here's a video of the Prince Albert Healthcare Clinic, Cooperative Clinic, and the Mobile Crisis Cooperative.
Hi, I'm Jack.
And I'm Tanner.
And welcome to the...
Did you know that Amazon has a $50 million fund
Apologies for that, folks.
that they have to pay out every month? And here's how.
Sorry about that. YouTube.
Diaries. Say hello to Prince Albert, Saskatchewan's gateway city. Cradled between open prairie and boreal forest, Prince Albert is the healthcare hub for the province's north. We visited two cooperatives that are key mental health and opiate recovery providers. Our first stop was at the Mobile Crisis Unit, who respond to emergencies at the scene and over the phone.
Our goal for sure is to attend at the time of crisis, and more importantly as well is to connect to ongoing services, right?
Yeah.
We always want to make sure that somebody has those services to fall back on. Maybe you have a trauma right now that something's happening and you have no idea where to go to get the services. And so we want to make sure we link you to them.
Okay, so you link those in crisis with services that can provide ongoing care and support.
Sure. Yeah, mental
Okay.
health, addiction services, child protection.
having someone who knows
Yeah.
the ins and outs of all the services is incredibly valuable.
And I think we always, you always want to be that in the community. You want to be that, to be able to bridge the gap between.
Yeah.
The community and the services during the day. Right, since workers are problem solvers, right?
Yeah.
So they want to be able to assist you.
You really do it all here.
Yeah, we do.
Yeah.
Yeah. And I think workers are so good at multitasking and they see, some of those things. And so they're great problem solvers. They,
Yeah.
they have that ability to talk to people and just to help them through their tough times.
Prince Albert Mayor Greg Dion has been a longtime advocate for healthcare in the city. He told us about the mobile crisis unit's importance to the community.
Well, if mobile crisis didn't exist, then it would fall on our police department. We're not mental health workers. And so you can't solve that. And when a uniform shows up, it's totally different than someone in a t-shirt and jeans that here, I'm here to help you.
Yeah.
As soon as they think of a uniform, they think of enforcement. And it may, in most cases, makes the situation worse. So the more that you can get the, as they call it, the frontline street workers out there, the more successful we are.
The Prince Albert Cooperative Health Center was our second stop. Since 1962, the center has offered their services to people from Prince Albert and northern Saskatchewan. In the last year alone, they helped 14,000 people access the help they need. We spoke to the executive director, Rennie Danilchuk, about the center, its services, and its role in the community. Can you tell me about the health concerns for Prince Albert?
Our health center does focus a lot on helping people with opiate addiction. So we have a harm reduction program that services, and it's on the opiate recovery.
So you guys are cooperative, membership based. What are some of the benefits that you roll into membership?
In the first days of opening up, the memberships were key to the operational aspect of purchasing equipment. Now it's a $5 fee, one-time lifetime fee. And you don't have to be a member to receive services.
Yeah.
Anyone who doesn't have health benefits through a third-party insurer can access services here. So most services that are provided here, there's very few that we charge for, but any that we do charge for, people receive a reduced rate.
All for a $5 membership.
That's right.
Yeah.
Once in a lifetime.
Yes,
Yes.
yeah, it's a great deal.
It is.
Yeah.
The cooperative healthcare center is, I call it the connection center, because they refer lots. But at least people feel good because now they feel like, oh, I'm getting to the end. I'm finally gonna get this dealt with. I went there, they put me on the right track. That's why I think they're so important.
We also spoke to Vicki LaRose, a founding member of the Health Center, who has been a dedicated fundraiser and facility user in recent years. Vicki spoke to us about why she continues to use their services nearly 60 years later.
What I appreciate about this clinic is usually you're rushed in and out in a doctor's office in 15 minutes. Well, when my nurse practitioner got done examining me from head to toe, 2 hours had gone by. I mean, you're not rushed in and out. This isn't like a factory. It serves every area of healthcare, covers the body, mind, every aspect of healthcare. I stay very well in this clinic, and you feel when you come that you are going to be well taken care of.
There we go. A little bit of information about the two healthcare co-ops in Prince Albert, Saskatchewan. And I think it really highlights one of the things that Mayor Ralph commented on, which is when you need the services, you get up off your backside and do it. In this case, ordinary community members had to come together, organize, and create these facilities to ensure that those services were available in their community. And although they might not be the ones doing the work, someone needed to get the ball rolling, to get the organization started, to raise the capital, and to move things forward. Okay, our next example is similar but a little bit different. And this one's called the Community First Health Co-op. It's located in Nelson, BC. Don't have a video of this one, unfortunately, but here's what it looks like. And this one is a little bit more traditional, I would say. We see a lot more of these kinds of healthcare cooperatives, healthcare clinics all over Canada. It's a community-owned cooperative. Anyone can join as a member, and anyone can help coordinate fundraising activities, contribute financially to the cooperative, with the goal of advocating for and expanding healthcare services in the town of Nelson. The way that the business model for this co-op works is largely as a manager of rentals. It provides the space for healthcare practitioners, as well as other community wellness activities. And it works with different healthcare providers to bring their services to the town. Because Nelson is not a hub, it's not a major city, it can't really compete with places like Kamloops, Kelowna, Vancouver, Victoria for attracting healthcare professionals. But what it can do is provide affordable space for people who want to work part-time in a community. And that's really what the building is made up of. You see assorted healthcare practitioners, community organizations that rent space, some of whom split their time amongst different towns. And having a space like this allows something like that to occur. So the revenue for this organization is largely generated through rent, but also through grants. As a nonprofit healthcare organization, the co-op can apply for capital grants, expansion grants, different monies for provincial, local governments, federal governments, or community organizations. I took a list of the different providers in the organization, and most of them are health related. There's podiatry services, massage therapists, mental health practitioners, but they do also have a few other types of organizations like an accounting service, a bookkeeper, things like that. So certainly if you're building a space with the intention of providing for healthcare service providers, you may also use that space for other income to ensure that things stay revenue positive. And there's a good mix of full-time healthcare providers and part-time providers. Again, a community the size of Nelson may not be able to support a full-time psychiatrist, but again, having a clinic that can operate for 1 or 2 days a week is a huge benefit for a community of about 10,000 people. So hopefully some of this is sounding good. Hopefully some of this is sounding like maybe this could work. Maybe, in Lac La Biche, we could entertain the idea of starting an organization that could advocate for our healthcare needs and provide space for more healthcare providers. So where do you start? I would recommend asking a couple of questions, because all cooperatives start when people come together around a common cause. So having a conversation around who's willing to lead some kind of development is really important. And earlier I asked, who's willing to give a bit of time, maybe a bit of money to start a healthcare organization? If that's something that interests you and you want to see expanded healthcare in your community, would you be willing to then be a part of a board of directors that leads the expansion of health services? Or if you are wanting to start a healthcare business, maybe you're a registered massage therapist and you want to work with another healthcare provider or two to set up your own clinic and operate a business. Are you willing to put in some time and effort and money to create your own organization? What are some of the local sources of funds? Off the top of the meeting, John mentioned a great program right now from Community Futures that provides support through loans and funding for healthcare businesses in Lac La Biche, which is a great opportunity. And what's the timeline for this? In my experience, creating more community-based infrastructure type cooperatives takes a while. Can the community wait that long? Is there an urgency? And if so, how motivated might people be to get behind a new initiative? for anything like this, I would also definitely shoulder tap folks in local government. I would definitely get in touch with an economic development officer or speak with some of your counselors. What supports could local government offer to expand healthcare services? Municipalities definitely have a vested interest in seeing more healthcare services in their community because it's going to be very attractive for new residents. So have a discussion with them. Is there maybe some municipally owned space that could be leased for fairly cheap? Is there money set aside that could be donated towards a project? Or could they simply provide some bookkeeping and admin support as an initiative moves forward? Have that discussion with your local government to see what supports are out there. And finally, what grants are available? The government of Alberta is making lots of changes to healthcare, but there are, of course, always grants available to businesses, nonprofits that are in the healthcare space. So do some research and see if there's some free money that you can tap into that can help cover some of those startup costs. And if you really want to get started, the list of things that you actually need, the key ingredients for a new cooperative is fairly straightforward. To register a new co-op in Alberta, you only need 3 people, 3 individuals or businesses that are willing to create the organization. To then recruit other members if needed. From there, crunch some numbers. Setting up a new business, certainly if you're building a new building and you're buying healthcare equipment, well, that comes with a lot of price tags. So understanding what those costs might be is really important for the startup process. And then understanding what monies are available to you is important for balancing that out. Are there monies that you can access from organizations like Community Futures? Are there grants available for the type of work you want to do? Or are there untapped financial resources from local investors who might want to tuck some money into a healthcare business to see their community benefit? And then identify that path forward. If all those things line up and you've got a group of people with a common goal and your business is fairly feasible from a financial perspective, well, can you move forward? And organizations like Co-operatives First, like Community Futures, can provide some of the guidance through that process. So I've mentioned we can provide some of that guidance. So here's some of the ways that we can help. If folks are interested in starting a new cooperative business, in starting a cooperative clinic or a cooperative healthcare business, please do get in touch with us. We can provide one-on-one support from our team of experts to provide you guidance through the startup process. We provide business planning and guidance every step of the way, including things like incorporating your cooperative and getting a governance structure in place. And if you're not 100% sure or you want to learn more, I would recommend checking out some of our online tools and resources. We have a whole online course dedicated to learning about what a cooperative is and going through the process of starting a cooperative. We've also got a website called coopcreator.ca where you can find lots of tools, resources, or information about how co-ops work and how you can start one and if it's the right fit. And all of those resources, all of our support and consultation, all of that's provided at no cost because we're funded to do this work. So that about does it for me. I'm more than happy to take any questions if folks want to talk more about ideas that they might have or healthcare or co-ops generally. If you scan that QR code, it'll take you to our newsletter called 3 Good Ideas, where we just share 3 cool ideas, stories, videos, courses about economic development, providing services, and community-owned organizations. So thank you all so much. Yeah, Any questions?